So continuing our focus on energy and vitality with a particular emphasis on mental health, our next speaker is Chris Palmer. Chris is a Harvard psychiatrist, researcher, and author of the acclaimed book Brain Energy, which explores how many mental disorders can be understood as metabolic disorders of the brain and are heavily influenced by our environment. He was eager to contribute to this discussion, and he recorded a message because he couldn't join us today. So we're going to share that now. Thanks.
Good afternoon. It's an honor to speak with you today about a topic that profoundly impacts every one of us, the mental health crisis. Across the globe, rates of mental illness are rising at an alarming rate. Depression has become the leading cause of disability worldwide, affecting over 300 million people. In the United States alone, anxiety disorders impact 40 million adults each year. Rates of autism have quadrupled in 20 years. Rates of ADHD have tripled over the same period. These statistics are not just numbers. They represent lives, families, and communities struggling under the weight of a crisis we are far from solving. This brings me to my work and a new understanding of mental health, one that challenges conventional paradigms and offers a path forward. My research has culminated in what I call the brain energy theory. At its core, this theory redefines mental disorders as metabolic disorders affecting the brain. It integrates decades of neuroscience, psychology, and metabolism research to propose that mental health and physical health are intimately connected. To function properly, the brain requires a finely tuned interplay of metabolic processes. When these processes falter, whether due to genetics, lifestyle, or environmental factors, the consequences can manifest as symptoms we recognize as mental illness. This includes depression, bipolar disorder, anxiety, schizophrenia. They all appear to be rooted in metabolic dysfunction at the cellular level. What this means is that we need to broaden our understanding of mental illness beyond traditional notions like chemical imbalances or even trauma and social adversity, though these undoubtedly do play a role in brain metabolism. We must also examine the broader environmental factors that shape our health, including our food supply. Our modern diets have shifted drastically over the past century. Ultra-processed foods now make up nearly 60% of the American diet, and they are wreaking havoc on our metabolic health. These foods are laden with refined sugars, unhealthy fats, and additives that disrupt energy regulation, promote inflammation, and impair mitochondrial function. The result? Not only are rates of obesity, diabetes, and heart disease soaring, but these metabolic diseases are intricately linked to the rise in mental health disorders. Environmental toxins further exacerbate the problem. Industrial chemicals, pesticides, and pollutants disrupt hormones and damage the very systems our brains depend on to thrive. Together, these factors create a perfect storm, tipping vulnerable individuals toward metabolic and consequently mental dysfunction. But the story doesn't end here. Within this challenge lies enormous hope. If we can recognize that mental health disorders have metabolic roots, we can develop treatments that target these mechanisms. Diet and lifestyle medicine, such as reducing ultra-processed foods, increasing physical activity, and adopting anti-inflammatory or ketogenic diets, have already shown promise in improving outcomes for people with treatment-resistant depression and even schizophrenia. We must also advocate for systemic change. Governments, food producers, and public health agencies must prioritize a healthier food supply, one that supports metabolic health rather than undermines it. By tackling these root causes, we can reduce the burden of mental illness and build a foundation for sustainable mental well-being. The mental health crisis is a wake-up call, not just for healthcare providers, but for society at large. The solutions we need are not confined to therapists' office or hospitals. They are in the fields where our food is grown, the schools where our children learn, and the workplace where we spend so much of our lives. Together, we can reimagine mental health care by embracing the connection between our bodies, our environment, and our minds. The brain energy theory offers a way forward, rooted in science and guided by hope. Thank you. Let's work together to turn this vision into reality.